Dr. Childs, one of the first things I think that's on many people's mind is what's going on the ground? What's the situational update here at Children's Hospital?
We have been busier with COVID than at any other time during the pandemic, and that's true for a lot of children's hospitals, especially in the South, where this surge with the Delta variant is hitting hardest. Over the last week, we've had 24 admissions to the hospital with COVID. Presently, we have 9 patients in the hospital as we started the day today. We've had as many as 14 at a time. We've kind of been fluctuating 7 to 10 patients per day. We've had up to 5 in the ICU at one time. We've had up to 4 on a ventilator at one time. But the good news is these patients have done well. The story is not so much about hospitalized patients when it comes to the children in our community. It's a lot of kids that are getting the virus and having symptoms. And we've said throughout the pandemic that this virus doesn't tend to make kids very sick. And the good news is that's still true. What we're seeing right now in the hospital is because so many kids have the virus. And if a lot of kids get it, there's going to be a select few that get sick enough or fragile enough that they need to be in the hospital. So the outpatient areas, the clinics, the urgent cares, the emergency room, they are busy.
We hear a lot, I hear a lot in the community, Delta is different. What does that mean, Dr. Childs? How, as a mom or dad, do I understand the phrase Delta is different?
It's much easier for transmission from person to person. So the things that we had kind of gotten lax about doing, whether it be masking in indoor public places, keeping distance, hand washing, it's much more important now, and and even that, it may not be as effective because it's just a very contagious airborne virus. Does it make kids sicker, or does it make all of us sicker? You know, I don't think we can say that for sure. I think it's, again, it's just so many kids are getting the virus that those who have fragile health or those that have immature immune systems they can struggle with this virus, sometimes need some help in the hospital temporarily.
Respiratory symptoms equal COVID. COVID positive equals hospitalization. Hospitalization equals severe illness. And I think it's easy to see how those dots are connected, but what I'm hearing from you is that equation can certainly be true, but it's true in a very limited sense. Is that accurate?
I think that is accurate. And so if your child is diagnosed with COVID, it's not great. Nobody wants this virus. It causes a lot of problems in terms of symptoms while you have it, and sometimes symptoms later. But it is not equal to, I need to be in the hospital.
How do we make sure that the public understands children's capacity to take care of their children?
Well, we're much busier than usual. This time of year we're not expecting to see winter time volumes, but that's what we're seeing right now. We have capacity to take care of what's here, and the vast majority of it is certainly not COVID. We're having winter in August. Our emergency room's busy, as all the emergency rooms in the city are right now. And we want the emergency room to be ready to take care of those sickest of patients. So if your needs are not as urgent, but you need some questions answered about your child's illness, then I think contacting your pediatrician, being seen at a pediatrician's office, or using one of the pediatric urgent care centers is ideal.
So if you're mom or dad, right, and you've now gotten the news that your child is COVID positive, or if you're concerned your child is at a high risk for getting COVID, what should you be thinking about?
Well, first let's talk about the illness. You want to make sure that your child is safe at home with the care measures that you have in place. So that primarily focuses on two things, Matt. It's, are they eating, but especially drinking enough to not get dehydrated, because sometimes COVID symptoms are vomiting and diarrhea, and they lose appetite, can't retain fluids, they can get dehydrated. And that's one of the main reasons that kids get admitted to the hospital. The other is really focused on respiratory or breathing symptoms. How fast or hard are they breathing? They're almost certainly coughing, and they may be running some fever. But you want to watch that breathing and see how much work is involved, whether it's a baby who may be really retracting or it's an older child who is having to sit up to breathe and work harder to breathe. That's when you should be concerned and seek that higher level of care.
I think it's important for us to remember what our responsibility is, which is to make recommendations that are based upon the information we have, and to allow mom and dad to be mom and dad and to make the decisions for their children every day. So what fits into that category of playing offense to play defense against a virus?
In the age of this variant, I think it's a very different decision. I think that you want to be vaccinated, because as contagious as this variant is, it's almost impossible to avoid this virus. If you don't have immunity against it, you're going to get it. And you don't want to get this. You may handle it just fine. I'm sure everybody knows people who have done just fine with it, but I bet everybody knows people who haven't. And we are seeing kids in the hospital that are sick with it. About half of the ones that we've admitted were old enough to vaccinate. And I want to mention that only to say, revisit that vaccination issue for those that are 12 and up. It has proven to be very safe. And it is a much safer choice to get the vaccine than to face the virus and take chances with what this virus can do. Now, not all cases are in the unvaccinated. Even if you've had the vaccine, you can get what is typically a mild case of this. But it reminds all of us why we've gone back to masking. You and I are a few feet apart. We're safe in a fairly open room to have a conversation. But indoor spaces where things are congested, I think you want to opt for masking. It's a choice. It's a choice in our area, but I think it's a safe choice to try to avoid getting this virus. Keeping a distance and hand washing also still important, but probably the single most important step is to use a mask barrier when you're in an environment where you're just too close to other people, especially other people that are not masked.